The broadcast is now starting. All attendees are in listen-only mode.
Hi, good evening. This is Faith Heisler from the Pennsylvania Department of Health. We're going to get started in just a minute. I wanted to let folks know now, and I'll let folks know again, that this session is going to be recorded. We hope to be able to utilize this broadly, so we will be recording it. So by staying on, you are consenting to that recording. Since there are folks still coming in, we'll get started in just one more minute. Okay, I think that we are set to get started. We have a lot of great information for you this evening. I'm going to start with a really brief introduction and then hand it over to the experts to talk through what's going on with monkeypox and answer some questions. My name is Faith Heisler. I'm the Director of Intergovernmental Affairs at the Pennsylvania Department of Health. And at the Pennsylvania Department of Health, beginning in May, we built a two-prong approach to try to educate folks around monkeypox. So it included educating our providers, our clinicians, and also educating the public. So understanding the vast majority of clinicians in the United States haven't had an opportunity to identify, test, or treat monkeypox, we understood there was a significant amount of support that would need to be leveraged to educate them. So we've been engaged in doing some of that work, but we also realize that it's really important to ensure that folks in the public have a good awareness around what this virus is, what this virus isn't, and how to protect themselves and others around them. So our public-facing initiatives have been focused on those currently most affected by monkeypox. Although anyone can get monkeypox, and I want to repeat that, anyone can get monkeypox. It's currently circulating in certain members of the LGBTQ community, and we'll go a little bit more in depth about that later. And so to best support this community, we've developed some partnerships and focus some efforts starting with Pride events and have engaged with the Bradbury Sullivan Center, the Greater Reading LGBT Center, and New Hope Celebrates to bring you this event today. So I would love to start by introducing Dr. Lisa Mchugh. Dr. Lisa Mchugh is currently the Assistant Director for the Bureau of Epidemiology at the Pennsylvania Department of Health. Dr. Mchugh has both a Master of Public Health and a doctoral degree in epidemiology, and she currently oversees activities associated with the COVID-19 and monkeypox outbreak response. In addition to these response activities, she manages the Healthcare Association Infections and HIV Surveillance programs. Dr. Mchugh has more than 20 years of experience working in local and state public health agencies with a focus on infectious disease epidemiology, surveillance, and outbreak response. We're very pleased to have her. I'm proud to call her a colleague, and at this point, I will hand it over to Dr. Mchugh.
Thanks very much. Thanks so much, Faith. So guys, I'm not going to stay on camera for very long, so I can glance down at my slides. It's a little distracting to see my face on the screen, but when we come back to the question and answer period, I'm happy to come back on camera and chat with folks. Just wanted to say hello, and we'll get started. So yeah, so I just want to kind of talk about monkeypox tonight, both understanding and treatment and preventing monkeypox. Welcome. Glad to have you all with us. Hope that you'll find this information very informative. So the World Health Organization declared monkeypox an outbreak, a public health emergency of international concern in the summer of 2020. And today we're going to talk about what that means and what Pennsylvanians should know about this particular virus. So just a reminder that this presentation is intended to provide a general overview and awareness for monkeypox for members of the general community. We've done other stuff for our healthcare providers and different other audiences. And so again, this is meant really to provide some awareness for our community members. So you likely saw monkeypox in the news. This slide actually lists some of the headlines that you might have seen. Yet many people in our communities feel like they may need to know a little bit more about the disease. And there's lots of myths concerning this disease, and there's a lot of questions about our particular response. So here we hope to kind of cover some of the things you may know, the things you may not know, and also try to help provide some answers to some of the questions that you might have. We do have some encouraging news when we talk about monkeypox. It isn't all bad. To date, there have been no deaths that have been reported in the United States due to monkeypox. And what we know is that monkeypox, unlike some of the other recent illnesses, are much less contagious. The current risk for monkeypox is pretty low to the general overall public, but it's still good for us to know all of the facts. So during this session, we hope to look at the history of monkeypox, and then we're going to take a look at different ways to prevent and treat monkeypox. And you'll see throughout this presentation the use of the word MPX as an abbreviation for monkeypox. Just wanted you to be mindful that you may see that as we continue to move forward. So viral outbreaks, including pox-type outbreaks, happen. They're not new. An outbreak is a rapid spread of a disease through a population over a very short period of time. I think we can all agree that monkeypox meets that criteria. And because a virus doesn't care about state lines or national borders, it can infect millions and span multiple continents rapidly. A pandemic is really that epidemic type outbreak that has spread over large regions of the world. For example, the smallpox infections were recorded way back to 10,000 BC and are thought to have been wiped out in 1979. Smallpox, which resulted in an estimated 300 million deaths, is similar to monkeypox in that it belongs to the same family of viruses called orthopox viruses, but monkeypox is very different. Other orthopox viruses include different things like smallpox and vaccinia and cowpox viruses, some of the things that you may have heard of in the past. So as I said, monkeypox isn't new. It was first discovered in 1958 when 2 outbreaks of pox-like virus occurred in colonies of monkeys that had been kept for research. And despite it being named monkeypox, the source of the disease really remains unknown. However, African rodents and non-human primates, like monkeys, might harbor the virus and allow it to infect people. The first human cases of monkeypox were recorded in the Democratic Republic of Congo in 1970, and monkeypox transmission is uncontrolled in Western and Central Africa, with the majority of cases occurring in the Democratic Republic of Congo, where the disease is reportable. There, the more virulent Congo Basin virus type virus has been infecting some of the world's poorest and socially excluded communities. And as you can see from the timeline that I'm presenting on this slide, prior to the 2022 outbreak, monkeypox had been reported in several Central and Western African countries. Previously, almost all monkeypox cases in people outside of Africa were linked to international travel to these countries, where the disease commonly occurs or is transported out of these countries through animals. These cases occur in other multiple continents, as you can sort of see listed here. An example of this occurred in 2003, where we found 47 cases here in the United States. When this outbreak occurred in 2003, there were 47 confirmed and probable cases that had been identified, and they were attributed to a shipment of wild animals from West Africa to the United States. In fact, Africa from 2020 to 2022 has recorded more than 12,000 cases and 363 deaths. So as I previously alluded to in the last slide, there are 2 known types or clades of monkeypox virus, one that originated in Central Africa and one that has originated in West Africa. The current world outbreak, the one we're experiencing in 2022, is caused by the less severe West African clade. The severity of the illness very much depends on the health of the individual, the route of the exposure, and the strain of the virus that they may have been infected with, the West African or Central African virus clades. The West African monkeypox is associated with milder disease, fewer deaths, and limited human-to-human transmission. Human infections with the Central African monkeypox clade typically are more severe as in comparison and have a much higher mortality or death rate. Person-to-person spread is also very well documented with the Central African monkey strain. So, sorry, this slide looks a little funny, but I'm going to try to work through it and read through it. Orthopox viruses happen. We see them a lot. While not all three on this slide are orthopox viruses, there's a comparison here between monkeypox and chickenpox and smallpox. Some of these you may have heard of before. Monkeypox is what we're currently talking about. Chickenpox is a very common childhood condition that many of you have probably already heard about. And smallpox, which fortunately for us has been eradicated, but is kind of thought to be monkeypox's bigger brother. So monkeypox has a relatively small death rate, although that really depends on the different clade or the strain of the virus, as I just spoke about. Typically, we see a fever 1 to 5 days before rash happens. The illness can last for about 2 to 4 weeks. The time between when you may have been exposed or in contact with somebody to the time you develop symptoms is about 5 to 21 days. Again, it's part of that orthopox family. And often the rash has a very distinct appearance in that it starts on the face and then spreads typically to other parts of the body and can include the palms of your hands and the soles of your feet. And the rash will eventually form scabs and fall off. And typically, you can also find swollen lymph nodes accompanying this particular presentation. Chickenpox, however, death is very rare. The rash usually comes after about a day or two of fever, lasts a little shorter, about a week. The time between when you're exposed to when you develop symptoms is about 10 to 21 days. And these tend to be itchy, blister-like rashes that usually start on the chest, back, and face. I'm not going to focus a ton on monkeypox, but the death rate associated with smallpox was very, very high, up to 30%. And while it looks a lot like monkeypox, it is very different in that particular regard. So you may have heard a lot about pandemics or endemics, and what does that really all mean? Well, the US World Health Organization has certainly taken rise to the notice in the cases that we're experiencing. And the CDC is tracking both this and outbreaks of monkeypox that have spread across multiple countries around the globe, including the United States. Monkeypox has been considered endemic, as I've previously mentioned, in many parts of Africa. And many of those places don't have the same type of medical care that we have here in the US. So in response to these increasing cases, on July 26, 2022, the World Health Organization declared the monkeypox outbreak a global health emergency of international concern. So while monkeypox has been and is endemic in some parts of the world, it's not currently a pandemic, and it's not likely to become one because of how it is not easily transmissible. We'll talk a little bit more about that in the upcoming slides. So what does monkeypox in the United States look like? Well, the US, similarly to the World Health Organization, declared a public health emergency. And what this does is it increases access to funds, allows the government new avenues to increase production of medical supplies, including using those vaccines. So CDC is tracking these diseases, and we use an unidentifiable information that we track and share information with CDC. There is a website that is available to show you where these cases are. Here you can see a snapshot of that particular page. This is actually as of August 9th, 2020. These numbers have slightly increased, and as of August 10th, the numbers were at over 10,000 monkeypox cases declared in the United States. So the CDC, in order to get these numbers, has made monkeypox a nationally notifiable condition, and that started on August 1st. And what that does is it means that states and localities can report those numbers to the CDC, and that allows them to actually develop the things like this map that you're seeing here, so that we can all be able to provide information on about the number of cases that are occurring. So similarly, in Pennsylvania, we also track those cases. Currently, we have approximately 270 cases of monkeypox. with the largest majority of those cases occurring in the southeast and southwest regions of our state, those that are highlighted by the green circles on the particular map on the slide. The Commonwealth's Department of Health, we've set up multiple guidelines for medical professionals on how to test and treat and vaccinate to help prevent monkeypox. We'll talk about treatment and vaccinating later in our session, but if you're here and you happen to be a medical provider, you can use this QR code to click and locate our HAN advisors or Health Alert Network advisories that are made available to our public health professionals and healthcare professionals with additional guidance on how they can handle and treat monkeypox patients. So what are the symptoms? You know, monkeypox usually is pretty clear-cut, it's pretty well studied, and we know that early symptoms often include fever, swollen lymph nodes, headache, muscle aches, and this is usually followed by a rash, which ends in firm, clearly established lesions or pimples or blisters that have smooth, rounded edges, and sometimes they have a little dimple in the middle. You may have heard us call that umbilicated. However, many cases in the current outbreak that we're seeing are not presenting with these early symptoms. Sometimes people will get a rash or a lesion first, followed by other symptoms, and some will only experience the rash or the lesion. Symptoms of monkeypox, as I've already said, are fever, headache, muscle aches and backaches, swollen lymph nodes, chills, exhaustion, respiratory symptoms such as sore throat, nasal congestion, or cough, and a rash. And this rash can be located near the genitals or the anus, but could also be included in places like the hands, feet, chest, face, or mouth. And the rash typically will go through a few different stages, including scabs, before they heal. As I've mentioned, the rash can look like pimples or blisters and can sometimes be very painful or it can be itchy. So I'll just warn that I'm going to show a few pictures in the next slide. So if you're a little squeamish, you may want to look away until we come back. But I'm going to show little pictures just so folks can understand what some of the monkeypox lesions might look like. So a person may be infected, as I've mentioned, with or without the rash. But if you do have a rash, here are some of the signs that you might look for. It could be a raised bump, very well defined, what they call deep-seated. So it's kind of not squishy on the top. And they often develop umbilication. So in some of these pictures, you can see that it looks like there's a little dot in the center. The lesions are relatively the same size and the same stage of development on a single side of the body. So you're not going to see one look like a pimple and one look like a blister. They're all going to look very similar. Disseminated rash is what we call centrifugal, so more lesions on the extremities in the face, meaning on your arms and legs and on your face than on the middle of your body. And you will often see lesions on your palms of your hands and soles on your feet. And again, they're often described as painful until the healing process, when they may become more itchy as they crust over. So for those of you who may have looked away, you can certainly look back at your screen now. So how is monkeypox spread? Well, the virus is not sexually transmitted. It's not a sexually transmitted infection, but it can be caught by very close personal skin-to-skin contact, which is why that it can often be spread to sexual partners. Monkeypox spreads through large respiratory droplets with prolonged face-to-face contact, contact with bodily fluids, and contact with contaminated objects or surfaces like clothing or bedding. So this can happen through hugging, massaging, and kissing. It can be happening with face-to-face contact. And when we say this, we're talking about extended contact. So within 6 feet of somebody for 3 hours or more. We're touching fabrics or objects during sex that were used by a person who may have also used it and had monkeypox. So that can be bedding and towels or anything that may have come in contact with that person. It's also a concern for pregnant persons because they can spread the virus to their fetus through the placenta. And obviously, as we've talked about in that 2003 outbreak, it's also possible for monkeypox to come from infected animals, either by being scratched or bitten by an animal, or preparing or eating meat using products from an infected animal. And while that's a place you can get monkeypox spread, that's not really something that we're concerned about in this current outbreak. So how do I avoid getting monkeypox? Well, you avoid close skin-to-skin contact with people who have a rash that looks like monkeypox. Do not touch the rash or the scabs. Do not kiss, hug, cuddle, or have sex. Avoid any objects or materials that a person with monkeypox has used. Don't share eating utensils or cups. Do not handle unwashed bedding, towels, or clothing. It's important to wash your hands often with soap and water or use alcohol-based hand sanitizers, especially before eating or touching your face and after using the bathroom. A common question we often get is, how do I clean up to prevent monkeypox? Well, the virus can survive anywhere between a couple of hours to a couple of days. And here's just a depiction of how long the virus can live on some commonly touched surfaces. But this can certainly change by a variety of different things, such as sanitation efforts and sunlight and temperature. So here you see glass for 5 days, wood for 4 days, plastic and stainless steel for 3 days, or 24 hours. But the good news is that the U.S. Environmental Protection Agency, or the EPA, has issued an emerging viral pathogens guidance in response to the cases of monkeypox. This guidance was created to allow disinfectant manufacturers to submit data demonstrating their products' effectiveness against monkeypox in order to kill it. The agency expects all of its products that disinfect for emerging viral pathogens to also kill monkeypox when used in accordance with label directions. While there are no specific disinfectants registered specifically against monkeypox, all products with this claim have been tested against the virus and can kill that monkeypox. So while it's a good idea that you specifically look up the different products on this EPA list, which is available through this QR code or directly by looking up on the EPA, you'll find that many of your common household disinfectants are already on this list and can be used to kill monkeypox. So it's very important that you not only commonly wipe down commonly touched surfaces in your home, but also if you're in a business or in other areas, this is one way that you can eliminate monkeypox from being a concern. So who does monkeypox affect? Well, monkeypox is rare. Certainly we are seeing an increasing number of cases, both as we mentioned in that Africa, but also in lots of other places. But anyone can get monkeypox. In Africa and those endemic areas, most of the cases occur among children under age 15 years of age. Outside of Africa, the disease appears to be more common in men who have sex with men, but there are a number of cases who people don't fall into that category. Who's at greatest risk? Well, monkeypox does not spread easily between people. However, anyone in close contact with a person with monkeypox can get it and should take steps to protect themselves. People who do not have monkeypox symptoms cannot spread the virus to others. People with monkeypox in the current outbreak generally report having close, sustained physical contact with other people who have monkeypox. And while many of those affected in the current global outbreak are gay, bisexual, or other men who have sex with men, anyone who has been in close contact with somebody with monkeypox can get that illness. So, what do you do if you've been exposed to monkeypox? And when we say exposed, this means that you've had that direct, close contact with a case that's already been identified as having monkeypox. You should monitor your health, check your temperature twice a day, and if you develop symptoms, you should self-isolate and contact your healthcare provider or healthcare department for further guidance. If you are contact and you remain asymptomatic, you can continue to do your normal routine daily activities. You can go to work or school. The incubation period for monkeypox, and again, that's the time from when you first were exposed until you develop symptoms, is somewhere between 3 and 17 days. If you are a contact, we do advise that you don't donate blood, cells, tissues, breast milk, semen, or organs while you are on the symptom surveillance. The other thing that you should do, if you have a new or unexplained rash that you do develop, you should avoid sex or being intimate with anybody until you've checked out with a healthcare provider to make sure that it isn't monkeypox. If you don't have a provider or health insurance, you can visit an emergency department, an urgent care clinic, or call the 877 PA Health line, and we will try to assist you. Again, if you do develop these symptoms, avoid gatherings, especially that may involve close personal skin-to-skin contact. And think about the people you had close contact with, either personal or sexual contact, during the last 21 days so that we can help identify them and get them have them also monitor their symptoms and potentially get them needed vaccine. If you do develop symptoms, you should remain isolated. If you have, including any kinds of respiratory illnesses, and make sure that if you do need to go out, that you're calling ahead to those providers. So what happens if you get diagnosed with monkeypox? Again, maybe you develop that fever, that sore throat, that runny nose, or the cough. You have a rash, you have some of these other symptoms. Well, the first step is to try to get tested. To diagnose monkeypox, healthcare provider takes a tissue sample from one of your open sores or those lesions, and they send it to a lab for something called a polymerase chain reaction or PCR test. There also may be a need to do a blood specimen if perhaps it's too far after your rash has developed. That's another way, but the PCR test is much more common. And again, if your test is positive, stay isolated and observe all of those other prevention practices until your rash has healed, all scabs have fallen off, and a fresh layer of intact skin has formed. So we know there's been a lot of concerns about getting tested. Several commercial laboratories and the state public health laboratory here in Pennsylvania offer monkeypox testing. The first step is that a person must be evaluated by a healthcare provider to determine if the symptoms that they're experiencing appear to be monkeypox and require testing. And that's because there are lots of other things that can cause rash-like illnesses that may resemble monkeypox but may not be monkeypox. And the best course of action is to have them evaluated by a healthcare provider. Your healthcare provider can collect specimens for testing and arrange for that testing to either go to the commercial laboratory or call us at the state health department to arrange for testing at our state public health laboratory. So what do you do if you get sick? Well, we recommend that people with monkeypox remain isolated at home or another location for the duration of their illness. Again, the information is that people can spread monkeypox from the time symptoms start and all the time the symptoms have resolved. This includes full healing of the rash with formulation of fresh layer of skin under those scabs. People with monkeypox would remain in isolation for the duration of their illness, and this can sometimes last 2 to 4 weeks. If for some reason an emergency does come up and you need to leave your home and you have monkeypox, you should avoid close and physical contact with people and animals, cover those lesions, wear a well-fitting mask, avoid public transportation, and when leaving your home, when it may be required for that medical care or emergency visit. And again, if you're going to a healthcare provider, please call ahead and alert them that you're coming in for an emergency. So until all of your signs and symptoms of monkeypox have fully resolved, you should not share items. You should not that are worn or handled by other people. Launder or disinfectant items that may be warm can still that have been touched by that lesion can still be infectious and cause illness in another person. You should avoid close physical contact, including sex or other close intimate contact with other people. You should not share utensils or cups, and those items should be cleaned and disinfected for use before they are used by others. Stay away from crowds and congregate settings. Wash your hands often or use alcohol-based hand sanitizers, especially after direct contact with the rash. So if you develop a rash, there are a couple of things that you can do. Again, keep that rash area clean and dry to protect against any additional infections that may occur. You may want to avoid some sun exposure to prevent any discoloration of your skin. You want to talk to your healthcare provider about potential over-the-counter medications that can help make those rash illnesses a little more comfortable. This might include things like oral antihistamines or topical lotions, creams, and gels. You can also consider a stool softener because this can help reduce comfort, especially if those lesions are in the anal or genital region. Again, we know that sometimes this can be painful, so you want to contact your healthcare provider. If you are having any pain, they can help you with that pain management. And additionally, there are additional prescription medicated mouthwashes and topical gels in case you have any sores around your mouth. So are there treatments for monkeypox? Most patients have a very mild illness and really require no treatment. Primarily, the treatment when needed is very supportive, but there is an antiviral. It's called tecovirimat, or sometimes referred to as TPOXX, that can be used for treatment. This is an FDA-approved treatment. It's actually for smallpox, which is the variola virus, but it is also very effective against other things, including monkeypox. The CDC holds a non-research expanded access investigational new drug, or IND protocol, that allows for the use of tecovirimat for primary and early empiric treatment of non-variola orthopox viruses, fancy way of saying monkeypox, in adults and children of all ages. If your healthcare provider thinks that you'll benefit from this medication, they will work with the Department of Health and follow FDA protocols to help administer this particular medication. So are there monkeypox vaccines? Well, there are in fact two vaccines. One is called ACAM 2000 and the other Diagnosing. And these vaccines are used to prevent monkeypox infection and can be used for post-exposure prophylaxis. While there is a supply of ACAM 2000, Diagnosing is preferred vaccine for use. ACAM cannot be used in many individuals who have underlying health conditions, as it is a live virus vaccine. In addition, the area where the vaccine is given, sometimes called the take, contains live virus, which can be infectious after the vaccination, and the person could inadvertently infect another person, which is why there's some concern about the use of ACAM 2000. And for this reason, Diagnosing is the preferred vaccine. The Department of Health is recommending the prioritization of first doses of Diagnosing, as many people are at risk as possible. Given the rapid increase in cases, we've developed a vaccine strategy in order to help prevent individuals from getting sick. Diagnosing is also indicated for the prevention of monkeypox disease in adults. And since no vaccine is 100% effective, it's important for individuals not just to get a vaccine, but also to reduce their risk of potential exposures, both before and after getting a vaccine. Our current vaccine response framework includes a diverse network of points of vaccination that include public health sites, STD clinics, FQHCs, FQHC lookalikes, and other sites who have a relationship with the primarily impacted population. Many of these sites may take walk-ins who can express a need for vaccine, or the point of vaccines by public health agencies. So how is vaccine distribution being prioritized? At this point, vaccine doses are being used to target those populations at highest risk of acquiring monkeypox and those who might have severe outcomes if they become infected. Currently, as I've mentioned in the past, this outbreak is largely affecting gay, bisexual, and other men who have sex with men. People who have been eligible for that vaccine have been identified by public health as a contact of someone with monkeypox. In this particular case, this is called post-exposure prophylaxis. And again, that's those individuals who have direct contact with a monkeypox case but are not yet sick. There's also something called enhanced PEP or Pep Plus Plus. This is also post-exposure vaccination and can prevent infection in known exposed individuals who may not know that they've had direct contact with an individual, but know that they're in a very high risk group and may have had contact given those particular exposures. And currently, due to the limited quantity of vaccines that are available, widespread pre-exposure prophylaxis, so that's a vaccine before you even know you've been exposed, are not currently recommended, but we will continue to use of that vaccine as supply chain increases for these particular vaccinations. So I want to go back and circle a little bit back on that Pep Plus Plus. So this is on the right-hand side of that screen. And this is really those individuals who report having a sex partner or other direct contact with a person, or they may have had multiple sex partners or anonymous sex partners in the past 14 days and have had some other potential exposures to monkeypox. And in those particular cases, if you think you've been exposed and you need to be vaccinated, you can contact our 1877 PA Healthline or your local health department, depending on where you're located, and we can help you try to find that dose of vaccine. So we know that the last 2 years have been incredibly difficult for a lot of people. You know, the COVID pandemic has changed so much of the way we live and work. And now we're just started to try to ease back into regular life, and we're hearing a lot of media stories about monkeypox as an emerging threat. But monkeypox is still considered a fairly rare disease, and it's spread through close contact, like kissing and sex. And though we're still learning a lot about how monkeypox spreads in people, the best way to protect yourself is to avoid contact with people who are infected. You can wash your hands frequently, wear a mask in crowded indoor spaces. Early symptoms of monkeypox often include flu-like symptoms, including fever, chills, and body ache. And after a few days, a rash often begins. And you should really seek your healthcare provider as soon as those symptoms start. So again, call your healthcare provider if you feel sick, have a fever, aches or swollen lymph nodes, have a new rash or sores, or have been identified as a close contact of an infected person. You should go immediately to the emergency room if you have trouble breathing, new or worsening chest pain, stiff neck, are confused and can't think clearly, difficulty speaking or moving, loss of consciousness, and fevers. And just a small plug that if you have flu-like symptoms, we're still seeing COVID-19 in the community, and you can also get tested for COVID. So the department, in an effort to try to produce some additional public-facing guidance, has also put up a monkeypox website. And again, get your phones out. This is a QR code that you can look up, and it'll take you straight to that particular page. And at that point, I will stop, and we will take questions. Thank you.
Yeah, thank you so very much, Dr. Mchugh. We did have a couple of questions come in. I also wanted to mention that today we are joined by Jill Garland, and she's our director of the Bureau of Communicable Diseases at the Pennsylvania Department of Health. So I'm going to start. The questions are starting to come in, which is great. Thank you for being engaged. The first one is it spreadable before someone develops lesions if they've only had other symptoms like fever, etc.?
Perfect. I can take that question. So the answer is that the disease can be spread as soon as a person develops symptoms. So it's not just specifically those lesions, but if a person has fever, the time from when that fever starts is really when the person can spread that illness.
Great. Thank you. There's another question that was addressed in the chat around one of your sources, so I'll refer that questioner to the chat. And just by way of reminders for folks that if you have any questions, please feel free to utilize that questions function. And then there was somebody who requested to go back to the QR code or repeat the website. Now, I'm not sure. There we have that QR code, and then there was another QR code about the cleaning products. I'm not sure which one, but maybe we can spend just a minute. Oh, and we also had one for practitioners. So if the questioner can either clarify their question there, or maybe we can just spend a moment. Just the final one. Great, thank you. Are there any additional questions? And while we're waiting, I just want to thank everybody for taking time in their evening to learn about this. It's so unbelievably important that folks have good information. And now, at the end of this session, we're all going to consider you public health partners, so you can go out and spread the word around factual information, which is oh so important. Okay, so another couple of questions have come in. So there's one that is asking what your thoughts are on the future of this virus. Is there going to be more spread? Which I know is tricky to answer, but if you wouldn't mind just trying your best, we would appreciate it.
Yeah, so that is definitely something that's a little bit tricky. You know, it's really hard to say what the future will hold. We know quite a bit about monkeypox. As I mentioned, there is a lot of cases that occur in Africa, typically with a different clade. You know, will we continue to see additional cases? I think it's likely that we will. But I do think that everybody trying to take the best precautions that they can to prevent themselves from getting illness is one of the best courses of action. And then I think also, you know, the use of vaccine and trying to protect as many people from developing the disease and spreading it to others is also something that I think will be extremely helpful. So really hard to tell what the future of the virus holds. Really, I think we all need to do our part and do a good prevention and try to get vaccine out there, which I know we're trying really hard to do.
Lisa and Faith, this is Jill Garland. I just wanted to add here, and I can drop it in the chat. But there, I mean, I know as you mentioned in your presentation, of course, avoiding certain activities is, you know, a surefire way to avoid acquiring this virus. But if individuals are sexually active, there are steps that you can take to reduce risk. And I know CDC has a lot of good information on their website about safer sex and safer sex gatherings. So I'm happy to drop the link in the chat for those who might be interested in that information.
Thanks to both of you. So here's a technical question. To obtain an accurate specimen, does a lesion need to be open or must it be lanced if dry?
Yeah, so that's a great question. Currently, the lesion does not need to be opened. There has been some changes in guidance that just a simple swabbing of the lesion using a dry swab and placed in a dry container is what is needed. I know in some circumstances, healthcare providers were unroofing, is what they call it, the lesion. Based on some of the newer technology, that is no longer needed. We just need to swab the lesion and leave it intact.
Thank you for that. Another one, and I've been hearing a lot about this, is it true that the smallpox vaccine can offer protection?
Yeah, so that's actually a really great question. And the answer is it depends. You know, we know that there are some military personnel who routinely get vaccinated for smallpox, and if they have a vaccine that's recent, like within 3 years, that can offer some protection. But if you've been vaccinated many years ago, usually pre-1970s for smallpox, it likely is not going to offer much protection for monkeypox. And Jill, I don't know if you want to add anything to that particular comment.
No, I agree with that. And the recommendation is to be vaccinated if you meet the criteria that you discussed earlier for either post-exposure prophylaxis PEP or Pep Plus Plus.
Okay, so here's another question, and it's asking if there are specific providers that are more skilled at diagnosing monkeypox. This questioner mentions that they had a friend who was misdiagnosed and found out a couple weeks later that they had it.
Yeah, I think that that's a great question. I think part of what we're finding with a lot of our provider groups is that the presentation of monkeypox is a little bit different during this particular outbreak, and so it can really mimic a couple of different other types of rashes. And so it really does take a little bit of a skilled provider to take a look at those rashes, and some of them are being misdiagnosed. I think what the department is doing is really trying to get out as much education to those providers as possible. Again, we're showing them similar pictures that we showed in the slide set tonight, but some of them are even more in depth to help providers understand what a monkeypox rash or lesion might look like and what that presentation is. So we're really trying to focus some of that education towards those providers so that they can more easily diagnose monkeypox and get folks tested who might need that testing.
Do you know if the vaccine is free if you have insurance?
Hi, Faith. This is Jill. I can take this one. So the vaccine we are receiving is coming from the federal government, from the Department of Health and Human Services, from the Strategic National Stockpile, and that is, a government-provided product. So the providers we are working with in the Department of Health are administering the vaccine, and they are able to do that at no cost and should be doing that at no cost to individuals. We have been asking and seeking more information from HHS, Department of Health and Human Services, on more documentation. Some of you may know that when the COVID vaccine was provided, it was very clear and in a provider agreement that there would be no cost to individuals for the vaccine. We don't exactly have that same documentation for this vaccine, but again, the network of providers we are working with in the department are able to provide it at no cost. And if you encounter any issues or concerns around that, you may certainly call the Department of Health, and we can work with you to make sure you can get to one of our state health centers or to a local health department or one of our providers to ensure that you will not be charged. And we can certainly work with our providers if that is an issue.
Thanks for that, Jill. So another question is, how will vaccine be administered? We are hearing about intradermal. Will it be the way old smallpox vaccine was administered, which I believe was 4-prong, or will it be given similarly to a TB test?
Lisa, I can kick this one off, and then if you have something to add, please feel free. You are correct about intradermal. There was an announcement yesterday that the FDA, the Federal Food and Drug Administration, issued what's called an emergency use authorization to allow for the vaccines to be more widely available by using a smaller dose and administering it in a different way. So right now it's being administered in what's called subcutaneous, which is, I'm not a doctor, so it's just something that goes more directly straight into your skin and right underneath your layer of skin. The new route of administration that they are allowing is called intradermal, and it is administered very much like a TB test. So it's just right underneath your layer of skin. Actually, I think within your layer of skin. So it is similar to a TB test that you might be familiar with. The old smallpox vaccine with the multi-prongs and the bifurcated needles is something that Dr. Mchugh described a little bit earlier, where it is, you get something called a take, and it is kind of an open wound. That's not what we're talking about here with the intradermal. It's more similar to a TB test. And Dr. Mchugh, I don't know if you have anything you want to add to that.
So Jill, I think you covered it, and yeah, the 4-pronged or the bifurcated needle is what you would think of as if you had an old smallpox vaccine. That is how that was given with that live vaccine, and so that is not what we're talking about in the intradermal, as you've mentioned, Jill.
Thank you. So you mentioned that monkeypox is showing higher numbers within the LGBTQ community. Are there statistics or numbers of cases inside and outside of the LGBT community?
Yeah, so we don't specifically stratify our numbers by inside or outside the LGBT community. We do have questions when we do our epidemiology investigations, and we try to interview cases and understand where their contacts were and the information that they might have, where their potential exposures are. And so that it's within that exposure information that we know that a lot of the cases are you know, individuals, mostly men who have sex with men, although that is not exclusively the characteristic that are part of our cases. But we can say that a lot of our cases have had close or direct contact with a monkeypox case. And so that's how we know that that is the predominant method of transmission of the monkeypox virus.
Great, thank you for that, Dr. Mchugh. I don't see any additional questions. I'll just, oh, there is somebody with what seems to be an access question with some specifics. I have this person's name, and we can probably do some outreach based on the registration to ensure that they're able to get the access that they are looking for. And so in addition to that question, there is one about high risk folks. So where can someone high risk access the vaccine?
So Faith, this is Jill. I think I can take this one, and this might be a good opportunity for me to give it a little bit of background on our strategy for distributing the vaccine. And I mean, to just be really, I think, open and honest about some of the challenges that we are facing as we roll this vaccine out, that might be even be a little bit different than what we experienced with the COVID-19 vaccine. As you've heard a couple of times, you know, we do have limited supply. So the emergency use authorization yesterday, of course, will allow the supply we have to go a little bit further because we'll be able to get 5 doses out of a vial versus 1 dose. But the distribution from the federal government via the Strategic National Stockpile is a very different method of distribution than what we are accustomed to with vaccine. So we are getting our deliveries to the state, but we are limited to each jurisdiction, each state actually is limited to 5 ship to locations. So what that does is then it depends on the health department and other counterparts in the Commonwealth to kind of move those doses then out to a broader network. So we have our 5 locations, and then we move doses to the local health departments, either a county or a municipal health department in the state. And then we're also working with a lot of other partners, I think, which Dr. Mchugh mentioned earlier, a lot of STD clinics, federally qualified health centers, our state health centers, et cetera. So we are still working to build our network of providers and add additional providers. We are trying to not inundate our providers because, you know, as you can imagine, we're getting a lot of calls and inquiries, and rightly so, and we want to be able to connect individuals who are, you know, meeting that criteria as a person at risk of acquiring monkeypox and connecting them with a provider in their area. Again, we are still building that network and really working diligently to do that. So if you are looking to connect with a provider for vaccine, what you can do is either call your local health department if you are in a jurisdiction with a county or municipal health department. And if you're not sure if you are, you can call the our Pennsylvania Department of Health at the 877 PA Health number that was on the slide earlier. And we can connect you either with your local health department or with one of our providers in your area. What will happen when you call in is that you will be connected to one of our public health nurses who will talk to you a little bit about your risk of exposure and if it is recommended for you to be vaccinated, and then they will inform you of where your local provider is, where you can go to receive that vaccine. And it may be any number of the providers that I mentioned earlier. It could be one of our state health centers, or another provider in the area. But I would recommend if you, and I am reading the questions, if you're in a particular area and you're having trouble, just give our 877 PA Health number a call, or as they said, we have your name and we can reach out to you directly, I believe.
Yeah, I'll be able to reach out via the email that was given for the registration. And Director Garland, do you think that you could really drill down on what does high risk mean for the purposes of the vaccine prioritization and the different groups that are considered that high risk?
I can do that if you just give me one moment to pull up our sheet.
I'm sorry, I don't mean to put you on the spot.
I really should have had it. I should have had it up. I should have been prepared for this, so I apologize.
No worries at all. I think high risk is just a term that can be maybe very broad and defined differently amongst different people. So it might be helpful for this group to just really drill down what does that mean.
Exactly. And just so you're aware, I mean, we are things are changing rapidly. So as an example, in Dr. Mchugh's presentation, she talked about our vaccination strategy and prioritizing first doses, et cetera. With the announcement yesterday, we are reviewing our guidance and our strategy and our materials that we have provided to our provider network and even on our website. So we're constantly reviewing and updating those as we go. And so we may be even updating these in the next few days. But as it stands now, let me read off our criteria that we are using to assess risk of exposure and eligibility for vaccine. As Dr. Mchugh mentioned, our highest priority is post-exposure prophylaxis, and that is, we call that PEP, and that is for individuals who are confirmed to have been in close contact with someone who was diagnosed with monkeypox. That's the easiest way to put it. The second priority is Pep Plus Plus or enhanced PEP, and that is essentially someone who has a high probability or a high likelihood to possibly have been in contact with someone who's positive for monkeypox. We sort of spell this out a little further, and we ask questions about the possible exposure, and we are including in this category individuals who report having a sex partner or another direct contact with someone who had been showing symptoms such as the rash that Dr. Mchugh described. So we don't necessarily have confirmation through our reporting structure of that person's diagnosis, but if someone reports they've been in close contact with someone with symptoms, that would be someone we would consider to benefit from vaccination. Our other criteria, I'll just read it off here: gay, bisexual, or other men who have sex with men, and or transgender, gender nonconforming, or gender non-binary persons who are 18 and older, who report having had multiple or anonymous sex partners in the past 14 days, and meet one of the following. So having knowledge or suspicion that they were exposed either to monkeypox or possibly another sexually transmitted disease in the past 14 days, someone who may have been diagnosed with an STD in the past 3 months. That may include gonorrhea, chlamydia, syphilis, or HIV. If someone who has those multiple or anonymous sex partners and attended an event such as a rave or a sex party, a sauna or a bathhouse, for example, or who met their anonymous partners online or exchanged money or other goods for sex. Again, just some more examples of this. If someone had the multiple or anonymous sex partners and has a condition that may increase risk for severe disease, such as HIV or another condition that creates an immunocompromised state, atopic dermatitis or eczema. if someone had the multiple or anonymous sex partners in the last 2 weeks and is already on HIV pre-exposure prophylaxis, or you may have heard that referred to as HIV PrEP, that would be another individual that may benefit from vaccination. In addition, if there are individuals who report being involved in an activity with that would be associated with risk of exposure, in an area perhaps where there are a lot of, this one sounds a little more confusing, but if you are at an event or participate in activities that would put you at risk, that skin-to-skin contact, for example, where you're aware that other cases have been diagnosed, that would be another example. And then our final criteria for the Pep Plus Plus would be sex workers of any sexual orientation or gender identity. So I know that list was long. I think we may have this on our website, but I'm not 100% sure at this point. And again, we may be, we're constantly looking at our criteria and updating it as this situation evolves.
Thank you so much for that. And we're actually going to use some of the questions from tonight to update our FAQ that's on our website to make sure that we're answering all of the questions that folks have about monkeypox to increase education and awareness. There's one other question, and it is, if you are high risk but older and have had smallpox vaccine when you were younger, would you still get the vaccine?
So, I mean, I can take that, Jill, if you want, and feel free to chime in. I mean, again, the smallpox vaccine, if you've had it when you were young, it's probably, it may offer some protection against the current monkeypox, but it's probably not going to be as effective as it would if you were to have a current dose of the monkeypox. So if you feel that you're in one of those high-risk criteria that Jill had just mentioned, you may want to consider getting vaccinated. Jill, you may have some additional comments.
Excuse me. No, I think you got it, Dr. McHugh. Thank you.
Great. So I don't see any additional questions. So I just want to take a moment. And if there's a comment about the transparency about specific providers for the vaccine. And again, we're happy to reach out, given the information that you have shared around where you've tried to access it, and work with you to ensure that you fall within the eligibility criteria and are able to access it. But with that, and that goes for anybody, so please feel free to spread that word. With that, I really want to thank Dr. McHugh and Director Garland for taking some time in their evening to go through all of this really valuable information around what monkeypox is, what it isn't, how to help educate the folks in this group, but also anybody that they go out and talk to about monkeypox. So really appreciate everybody's time and partnership in making sure that us as members of the public are really well informed and can combat some of that misinformation that's spreading and can take care of ourselves and the people around us. So I don't see any additional questions coming in, and I think that is a wrap. If you have any other closing statements, Dr. McHugh or Director Garland, please feel free to go ahead with those now.
I'll just thank everyone for attending. I hope that you found what we presented useful. Hope you can help spread some of the information that you received here this evening if it was new information to you. And again, just keep in touch with us at the department, at our websites and at our information. And hopefully we will try to get, as Faith mentioned, use some of the information that we're hearing from you to hopefully address and adjust some of our messaging as we move forward. So thank you so much for being with us and being attentive.
And Faith, this is Jill. I just want to echo Dr. McHugh's comments and thank everyone for joining us this evening.